Let's see an NCLEX video tips and points on HIV and multidrug resistant organisms. This is the classification of HIV infection in adults. The classification is mainly three. The first one is HIV infection stage 1. Here we will be seeing three things in the classification. One is the CD4 plus counts, CD4 plus at percentage of total lymphocytes, and AIDS defining condition. In the first stage of HIV infection, the CD4 plus count is at least 500 cells per microliter and CD4 plus percentage of total lymphocytes is at least 29%. There is no AIDS defining condition. In stage 2 of HIV, there is 200 to 499 cells per microliter of CD4 plus count and CD4 plus percentage of total lymphocytes is 14% to 28%. There is no AIDS defining condition. In HIV infection stage 3, which is known as AIDS, there is less than 200 cells per microliter of CD4 plus count and less than 14% of CD4 plus percentage of total lymphocytes, and yes, there is AIDS defining condition. Individuals who have an allergic reaction to the sulfa component in Bactrim, that is a medication that is used for the prophylaxis of HIV, it may have a delayed manifestation of their allergy. The rash associated with an allergic reaction to Bactrim may not occur for 7 to 14 days after starting the medication. So when assessing the patient who presents with a new rash, the nurse should ask about starting Bactrim within the past 2 weeks. This is an important nursing consideration. The second point for this drug is the sudden onset of anemia in an individual who has recently started Bactrim may be a sign of another serious manifestation of an adverse reaction of the sulfa component. Hemolytic anemia caused by G6PD deficiency, that is glucose 6-phosphate dehydrogenase deficiency. That's an enzyme that supports the functioning of RBC cells. It can be precipitated by allergic reaction to sulfa. This is more common in African Americans. These 2 points are very much important when we are dealing with the drug Bactrim. Risk factors for multi-drug resistant organisms. The first is hospital-acquired MRSA or hospital-acquired methicillin-resistant Staphylococcus aureus. The risk factors for getting this infection is current or recent hospitalization, residing in long-term care facility, invasive procedures or medical devices, recent antibiotic use, weakened immune system, comorbid conditions, dialysis devices, gastrointestinal disorders. So you need to know that if a patient is in any of these things, they have a chance of getting this hospital-acquired MRSA. Second is risk factors for community-acquired MRSA, less than 2 years of age, athletes, IV drug abusers, men who have sex with men, military personnel, prison inmates, people living in shelters. VRE or vancomycin resistant enterococcus, the risk factors include prolonged hospitalization, weakened immune system, prolonged antibiotic exposure, invasive procedures or medical devices, comorbid conditions. For Clostridioides difficile, the risk factors include recent antibiotic use, greater than 64 years old, NG tube or feeding tubes, prolonged hospitalization, chemotherapy, gastrointestinal surgery, acid suppressing medications, comorbid conditions. For Acinetobacter baumannii, the risk factors include recent surgery, invasive procedures or medical devices, tracheostomy, mechanical ventilation, enteral feeding, recent antibiotic use, prolonged hospitalization, intensive care unit admission, prior hospitalization, residing in long-term care facility. For CRE or carbapenem resistant Enterobacteriaceae, the risk factors include weakened immune system, disruption in the body's natural flora, mechanical ventilation, indwelling devices such as Foley's catheter, central venous catheters, and feeding tubes, patients in hospitals and long-term care facilities, older adults, comorbid conditions like heart disease, diabetes, or renal disease. Hope you understood this video. Please do keep watching for more tips and points.